do it. The governor joins me right now. Governor, very good to see you.
Thank you for having me.
Does that bug you when you hear the president? I've heard this a lot of times, and you say something often enough, people start to believe it, that Republicans haven't come up with alternatives their own. I mean, in the case of the Senate, there are four good ones, but they don't get past Harry Reid. You have a plan, doesn't get much press coverage. Does that bug you that it looks like Republicans are all about oppose, oppose, oppose?
Well, look, you can add the fact that the president's claim that Republicans don't have a plan, that list of lies that he has said. For example, you can keep your doctor if you like your doctor. You can keep your insurance if you like your insurance. He's going to cut premiums $2,500. Premiums actually went up $2,100 according to the CBO. When he said that then Senator Clinton, he was against a mandate before he put a mandate in his bill. So this is just yet another lie. But let's be clear. Obamacare wouldn't have become law without those lies. If he hadn't looked the American people in the face and promised them he was going to let them keep their plans, keep their doctors, cut their premiums, there's no way this would have passed.
Any inkling of what happened since would have doomed it. While you're here, Governor, I want to get into your plan, but I also want to bring to light comments by Robert Gibbs, the former White House press secretary, saying that the employer mandate will be one of the, quote, first things to go. He was talking about Obamacare, saying, and I add here, I don't think the employer mandate will go into effect. It's a small part of the law. I think it will be one of the first things to go. Now we find out. What do you think?
Well, it's amazing how Democrats are running away from this law. You and I were talking, President Clinton's telling them to embrace this law. I hope they do, because I think it'll cost them several seats. We need to repeal this entire law. It's a bad law.
Well, you know what Bill Clinton's saying, though, that there's a lot of good in it, and if you keep running away from the bad parts and don't embrace the good by saying coverage of pre-existing conditions and lifting lifetime caps, people will think you're just a phony.
Well, the problem they've got is the president was articulate when he described the problems in health care. In 2008, when he was he sounded like a conservative. He said, look, we've got to make health care more affordable. The reason people aren't care is not because they don't want it, so we don't need a mandate. The reality is there are things we can do to help people with pre-existing conditions. There are things we can do to drive down the cost of health care. There are things we can do to help the most vulnerable.
Would your plan, Governor, cover everybody? Is that the goal?
My plan would lower health care costs. It would help folks with pre-existing conditions. So it does several things, 16 different points. For example, and I won't go through all of them, don't worry, but a few of them. For example, it gives folks a standard deduction so you can buy your health care even if you don't have employer-provided coverage. You can keep your health care. You can buy health care if you change jobs, move across state lines. Lawsuit reform to drive down the unnecessary costs of frivolous lawsuits. We save seniors money in Medicare through premium support, Medigap reform. Save them money, save taxpayers money.
But it's volume that produces discounts. Isn't that the idea behind the president's plan?
Well, the idea behind the president's plan is he's going to make you buy something whether you want it or not. The idea behind the president's plan is the government knows better than you. The fundamental difference is we trust patients to make decisions working with their doctors and their providers. The president doesn't trust the American people. He's basically telling the American people, you can't buy that insurance product you used to want to have. Remember, 4.7 million cancellation notices last year. We trust the American people. We trust local government. We trust states to give them flexibility in Medicaid. We trust competition. You know, one estimate says premiums would go down $5,000 for a family in our reforms compared to what's happened under the president's plan.
Well, no offense to your estimates, and what could happen. The president had estimates too. But I guess what I'm asking, Governor, is do you recognize, because I think this is the reality, anyone who promises full coverage for everyone, I don't know if that is part of the Jindal plan. It doesn't happen. Even with the president's plan, we're going to have north of 30 to 35 million Americans who will never have health care coverage, which was a shock to me because I thought we upended our health care system to make sure everyone was covered, and we're going to have about the same number who weren't covered in the end.
Absolutely. Look, the uninsured rate, just you look at the recent Gallup numbers, are actually higher, about where they were, a little higher. They were in that first quarter when the president first took over.
Well, do you buy the 7.1 million figure he's mentioned?
Well, no, two things. One, they don't tell you how many were previously uninsured, how many lost their coverage to Obamacare, how many paid premiums. But here's the most, even if you...
By the way, we did a study on this and brought calculators. It's likely 1 million, not 7.
Right, even if it were 7 million. So what? So they, through the threat of the IRS, they forced 7 million people to do this. If they threatened imprisonment, if they threatened jail...
Well, how do you make it happen?
They might have gotten more. Well, you asked a very good question. You know, when you ask, does this cover everybody? This does drive down costs. This does help those that are most vulnerable. I don't think conservatives need to get in this bidding war with the Democrats where we say, hey, if they're going to do this, we're going to do as much. Because once we do that, they will always spend more than we do. They will always try to give away more, quote, free things from the government.
Well, here's something that joins most Americans of all parties. pre-existing conditions. They want coverage for pre-existing conditions. Does your plan have that?
Yes, and it does that in 3 ways. One, we give grants to the states to help them set up high-risk reinsurance pools, and we require them.
But are they going to pay more? That is, people for that benefit, are they going to pay more?
No, with that help, we make the states, if they're going to use these dollars, to show they're reducing premiums in their states. Secondly, we give guaranteed portability, renewability. So now you have to exhaust your employer coverage before you go in the individual market. We remove that. Third, we give people a new way to buy insurance. Right now, if you want scales, like you said, volume drives down costs, why not give people the opportunity to join voluntary cross-state purchasing pools, whether through their, not only their employers, but through unions, churches, social clubs, and finally, we let people buy insurance cross state lines, give more competition. If you get a more affordable plan, that way, if you live in Louisiana, you can buy a plan from another state and vice versa. So absolutely, this helps people with pre-existing conditions, drives down costs, but most importantly, it trusts the patient. It says, we want you and your doctor making decisions, not government bureaucrats, not insurance bureaucrats, because that mom knows her child best. She knows what that child is.
I understand. You know, when a lot of you Republicans gathered together, a couple of months back, I guess, you said that it would be impossible to repeal this thing the way things are right now, which might or might not be true. But I had some Tea Partiers on here, Governor, who said, well, we've just given up the fight. Can you clarify that Republican governor's position? Was it saying that recognizing the math and the calculus now in the Senate and with the president still in the White House, or were you saying that down the road we get a Republican Senate, we take over the White House, things change?
No, Neil, I've never said that. I've always said we've got to repeal the entire program. There are Republicans in
So you're
D.C.
not in that camp that says among your Republican colleagues, the train has left the station, too late to turn it back?
Absolutely not. My plan repeals the entire Obamacare, all the taxes, all the Medicare cuts, does not restore any of them, does not assume any of them.
So what do you think when the president goes back at guys like you said, this thing would be a much bigger success if not for guys like Jindal blocking me?
You know, it's not just bad execution, it's a bad design. What the president doesn't fundamentally understand is that Obamacare is a great example that progressivism doesn't work. Big government doesn't work. All the things he promised, when you look at it, it hasn't happened. Premiums went up, not down. Doctors are leaving the program. The number of doctors leaving Medicare tripled between 2009 and 2012. People are now finding with their plans, a lot of them can't get the specialists they want. They can't get the hospitals they want. This is not producing the results he promised. It's yet another example big government doesn't work. So he can blame us for his failures. This is a badly designed law.
Governor, are you surprised how much your fellow governor, Chris Christie, has tumbled in the polls?
Look, Chris has said he's taken full responsibility. He's cooperating with all the investigations.
I know that, but are you surprised how much he's tumbled?
No, look, I think he continues to do a good job for New Jersey. He continues to lead the RJ. At the end of the day, he's
never going to be president.
He has done what he said he was going to do. He said he was going to cooperate with the investigations.
I know, but he's never going to be president, is he?
Look, the voters will decide that. Let's win the war of ideas.
Do you want to be?
We're thinking about it. But let's win the war.
When will you decide?
The war of ideas. Not before the 2014 election.
But will you decide it here first? You're not going to go on O'Reilly, are you?
We'll certainly come talk to you about it as we make. But let's win the war of ideas first.
Are you a lawyer? Because that's a lawyer.
Oh, the guy.
Right.
That's an insult. I thought we were friends.
I'm sorry. That was a mean thing to say, and you deserve better. Governor Jindal, it's always a pleasure, sir. Thank you.
Neil, thank
very, very much. I just want you guys to be aware. I mean,